Hey Celeste, welcome back. How are you feeling?
I'm coping.
Yeah, it sounds like, from last week you were having a hard time. I was just reviewing your assessment from last week, your wellness assessment. Um,
Yeah.
yeah. Tell me about, you said you were having difficulty sleeping, um, and getting very anxious. Can you tell me about what that was about and what your goals are for working with that?
Yeah, I'm still having trouble sleeping. For some reason I can't get more than 5 hours of sleep, no matter how early or late I go to bed. And if I go like by 9 or 10 o'clock, no electronics, like you said, lights are off. I'm always up at like 2 a.m. until about 5 when it's time for me to wake up. And then I'm able to get like maybe a few more minutes after that, and then I don't know. It's just it's like off and on for 5 hours most nights, and then of course I'm tired during the day, and so that makes me more anxious when I'm driving or if I have to go run errands. I hate grocery stores, and so I try not to go in them. I avoid going in those. And then um, my family, I get really irritated. Patience is very short for people, especially my family, the ones closest to me. And um, I'm just tired of it. It's been going on too long.
Yeah, it sounds like you've been dealing with this for a very long time, and since being, you said you retired and stuff out of the military. um
Yeah.
yeah, that transition sounds like it was difficult in what you're just experiencing.
Yeah, it's an ongoing thing. Like some days are better than others, but I don't know. It's one of those things where, like, didn't want to go, but I didn't really want to stay either. And so now I'm just dealing one day at a time. I don't really have a new profession because I don't want to start something new having to let it go like the military, like that was a 20-year career for me. And so now to start something new, I get anxious about that too, because now I'm doing the math like, whoo, to work on another job for 20 years, I'll be this age. And so, yeah. So anyway, I don't really want a new profession.
Yeah, so it sounds like that anxiety and just the sleeplessness is affecting you today and your career choice and what you want to do. Um, so I want us to kind of explore and look at. I have two assessments I would like to give you today, and we can kind of go through those. Take a minute um, to kind of rate your anxiety. It's called generalized anxiety disorder. It's a 7 item. So you have it in front of you. You just take a minute to fill that out, and then we'll review your scores. And then sounds like some of the symptoms that you might have experienced. We want to do a pre-screening for that PTSD. I know you had prior. We talked about some of your deployments and how it was hard to integrate back with your family, like you said, grocery store and everything. So we're going to kind of look at, there's just 5 questions. We'll look at that. So go ahead and take a minute and tell me what you have there.
Um, the feeling nervous, anxious, or on edge nearly every day.
Okay.
And not being able to stop or control worrying nearly every day. And worrying too much about different things nearly every day. Trouble relaxing nearly every day. Being so restless that it's hard to sit still nearly every day. Becoming easily annoyed or irritable nearly every day. Feeling afraid as if something awful might happen nearly every day.
Okay, so Celeste, thank you for filling that out. Just by tallying up your scores, it sounds like and looks like that you are experiencing a high anxiety. So your score nearly every day it scored 3 on each one for the 7 items, so that's 21 points. So based on what you score on the scale, it shows that your anxiety is severe right now. Would you say that it's impacting your life and right now?
Yes.
Okay. In what ways do you feel it's impacting your life?
Because some days I don't want to leave the house. Some days people don't want to be around me. Some days I'm hungry because I don't want to go out and get something to eat. So I'm losing weight. And then I don't know, the only place I really feel safe is at home. I don't like going out at all.
Yeah. I know that that can be hard, challenging to be, experiencing that on a near to day daily basis. So Celeste, we're gonna just take another minute to look at the pre-screen for the PTSD. You can kind of answer those. It's just 5 questions, and then we'll move on from there.
Had nightmares about the event, thought about the event when you did not want to. Yes. Try hard not to think about the event or went out of your way to avoid situations. Yes. Being constantly on guard, watchful, easily startled. Yes. Felt numb or detached from people, activities, or your surrounding. Yes. Felt guilty or unable to stop blaming yourself or others for the events or any problems the events may have caused. Yes.
Yeah, so looking at your pre-screen, it looks like you may qualify for meet the criteria for PTSD, post-traumatic stress. Next week we'll look at um, another assessment, but today I want to kind of talk to you about the treatment of just integrating you and helping you to see what treatment options are available and some goals. What would you say goals are for you with reducing some of that anxiety and your PTSD symptoms?
Well, first, I want to be the person that I was to my family while I was in the military. Now they don't like calling or talking to me because I'm so emotional. And if I'm not crying, I'm fussing. So um, I guess just being the person, that normal person that I was before I got out of the military. And then my spouse as well, too. Like, I want us to be able to laugh and do things that we enjoyed before I got out. And I want to feel safe in places other than home.
Yeah, well, that sounds like a great goal, and I'm just here on the process, the journey with you. So I thank you for allowing me to be on that process. So one of the treatments that I use for individuals that have experienced trauma or PTSD is cognitive processing therapy. So what that comprises of, it is a cognitive behavior treatment um, mixed along with it's a trauma informed evidence-based practice as well. So CPT is what we abbreviate it. It's effective when working with individuals that experience trauma, whether being a veteran, combat, or civilian. So some of those topics that we'll talk about are we're going to identify some of those um, thoughts and feelings that you have, maybe those stuck points that you have about your trauma or why it happened. So, safety issues, you mentioned safety, that you don't sometimes feel safe, and then trust issues as well. We'll also look at some esteem issues as well, and intimacy issues. You mentioned with your spouse and partner that you want to connect in that way. So our goal is to improve, we'll start off with just educating you about some of the PTSD, understanding what PTSD is, the symptoms, Try to help you with reducing your distressing memories about your trauma. Maybe, getting out of the military was traumatic for you, losing that grief and loss. And then you talked about avoidance. So decreasing some of those numbing avoidance feelings that you have, and then the reducing those feelings about being on edge and intense, and as well as your depression and anxiety and worry. So overall, Celeste, we want to improve your day-to-day living. How does that sound for you?
That sounds like a good plan and goal.
Okay. So now these particular sessions, it takes 12 up to 12 sessions, 12 to 15. They're very structured, but we'll have some homework, practice work. That will be some of the things we're going to challenge some of those anxious thoughts that you might be having, and then look at some of those trust issues. So you're ready to get started?
Yay. Yes. Feeling confident now.
Awesome. Thank you again. We'll talk next week, looking at your treatment plan and review the goals that you set. Okay. So thank you again, Celeste, for coming in, and we'll talk soon. Bye.
Bye.